It's a great question. I think the first is we maintain a level of perspective, and our players, our athletes, sometimes people forget that they're people and they're humans as well, and so they're watching the same thing that everyone else is, and so their perspective has been really, really good, to say that a sport is a sport. Right now, we're in a pandemic. The priorities of frontline workers and from nurses, from doctors, from police officers, firemen, their perspective has been really, really good. But as time goes on, they start thinking, what do I need to do? And so mental health is obviously critical. Players are in different environments, whether they're club teams or their homes. They may be by themselves, may not necessarily have a network that they're so used to being around their teammates and those families. So we want to make sure that we've created some opportunities for them. We've had different Zoom calls to answer their questions, but then moving into their physical and their wellness side, our sports scientists and our athletic trainers have reached out to them to provide them different exercise tools, nutritional ideas and concepts, making sure that they're staying focused in a regimented routine, because it's easy to fall out of your routine during this period of time. And overwhelmingly, I feel like it's been fairly positive. Everyone has felt that we've been engaged, we've been supportive, and it's a balance between what we do as a national team, but to supplement what they currently are getting in their club environment. Without a doubt, we're all either doing team Zoom virtual kind of meetings. Our sports performance folks are having individual call-ins with players, checking in on them, making sure if they need anything. So those things are actually probably keeping us busier than we have in the past. And what I think has been a really positive thing out of this, especially for a national team, is we typically have this engagement with them only when we're in a national team camp. When they're with their club, we're really kind of not engaged with them. So this really allows us to establish even more relationship building, trust with some of our national team players that we haven't had a chance to do in the past because everyone is so busy. Well, I think that if we don't learn from things, then it's our own fault. But I think it's even, there's a population of our elite athletes that a lot of people say, well, it's their job to eat well and to sleep well and to have that mental health side. I think this pandemic is showing that this is something that each person needs to have and own their health and nutrition. And this is something broadly across the general public. We're seeing, a lot of research that's showing vitamin D deficiencies, vitamin C deficiencies, that COVID is having a bigger morbidity and mortality in those populations. And we're still going to learn so much more. Those individuals, unfortunately, that have, and it's not just them, but those that have underlying chronic illnesses are susceptible. I think that there's so much that we're going to learn from this. In our society, we work so much that our wellness is something that's secondary or tertiary. And hopefully employers and employees start putting, their health and wellness as a daily routine. And it's not just the employees or the individuals that carve that time out, but us as a society start carving that time out. And if we don't learn from that, then sadly, we're gonna have this happen to us again. I think some people will, but in general, it has to become a cultural thing. It has to be a part of our daily life, and it has to be allowed and accepted in our society. As a physician and as someone who's in sports medicine for the last 20 years, we're always fighting that, whether it be, insurance companies, employers, to allow exercise as a prescription in life.
Right.
And it should be. When you go see your physician and you should talk about what your exercise program looks like, what your mental health side is, what your nutrition is, in addition to all the other things that they speak about.